Tesha, thank you for coming today to share your experiences and experiences of other parents in terms of some of the challenges of medication administration in child care programs. First, can you give me your full name and also the organization that you represent?
My name is Tesha Imperati, and I work for the Connecticut Family Support Network, and we're a statewide organization that helps families that have children with disabilities, special health care needs, find resources, empower parents. We have training, support groups. So we help parents, and there's 9 of us in our organization, and we're all parents of children with special needs.
That's great. I'm especially interested in learning more about, as I said, some of the challenges that parents may have experienced enrolling their children in child care, family child care, Head Start programs. I have heard many stories over the years from parents who either their children had special needs requiring medication or their child developed a special need. And I understand that there were some issues. And can you tell us some stories that you have heard?
Yeah, absolutely. I've had parents call me that have lost jobs because every time something would happen and their child needed medication and there was no one there qualified to do it, they would get called at work, and work just wouldn't tolerate it any longer. So these parents would lose their jobs because they had to stay home with their kids now because their children have nowhere to go. We get those phone calls often statewide where people are constantly looking for daycare settings where they can put their child that is affordable, safe, and knowledgeable staff. And it's not easy to find because the ones that do accept those students or children book up so quickly that there's very few out there.
So it's interesting, from your perspective, you're saying that parents are having a difficult time finding programs that will administer medications.
Oh, absolutely. Mm-hmm.
Can you tell me some of the conditions or some of the medications that children may need?
It's as simple as an EpiPen, where most of the people that are working in the daycare centers are not qualified, have not been trained. So they will not do it. So they say to the parents, either you can come in and do it or have somebody come in and do it, or we can't accept your child because we can't do that. So parents are struggling.
Sure. And of course, in the case of an EpiPen, even if a parent could come, it's not sufficient because that is an emergency medication and you must have a trained provider on site. Do you have any idea, or do you ever get feedback from providers about why they're not administering medication?
Some providers just outright do not want to do it, and they just won't do it. It's their policy. But then we've had phone calls from providers over the years asking us, we want to be trained to do this so we can accept these children and the parents can feel comfortable. So there are providers out there who are willing to do it. But I think if there was a program that was presented to providers, I think more would do this.
Great. So in addition to EpiPen, is there any other medications, or is that the one that most often comes to mind?
That's the one that most often comes to mind. But there are even, our children who have ADD and ADHD that need medication. And the schools, I think the daycare providers, what it comes down to is they don't want that liability because they don't have that training.
And it's interesting that I understand the resistance and the fear of the providers. I've studied that, talked to a lot of providers in the past. And of course, you are very familiar with the Americans with Disabilities Act. And have providers, have they been informed of ADA and the risk that that may pose for them in refusing children?
Unfortunately, I've come across where they have no idea about that at all. But some just, if it's an in-home daycare provider, they feel that they don't have to go by that. And we do have to encourage families to file complaints with I believe it's the Department of Public Health. So we do encourage families to do that. We don't like that, but for change to happen, there needs to be an awareness. So I think, honestly, what it comes down to, and I've had parents say to us, oh, they told us they can't take our child because their insurance won't cover it. And, it's just a lack of communication, and I think it's a fear too.
Do you have a sense of, are you hearing more of resistance from center-based providers or family providers?
Honestly, center-based providers.
Interesting.
I think the family providers are more open, and they have a smaller core group of kids. I think the center-based providers, they have I think one of the biggest issues is they have such a turnover with staff.
Yes.
Which is another issue, that if they do get this training, their staff, a lot of times this is just a stepping stone for them to move on to something else, which is great. But I think that poses another problem.
So they need constantly to be retrained.
Exactly.
Right. Great. One of the points you made, we obviously want to go a more positive route than the negative route of reporting to Department of Public Health. It seems that in some ways it's a need for resources. You're saying providers are calling and saying, I want to get trained. Can you tell me more about what has happened with those providers who say they want to get trained? Do they have difficulty finding a training?
There are trainings out there. I mean, we'll even say to them, call, if there's a specific child, work with the pediatrician. And they've sat down and had a team meeting with the parents and a nurse practitioner, the pediatrician, and they've gotten training that way just from the child's pediatrician. So that was one way they did it. And a lot of times they'll just call us and we'll give them ideas and suggestions. But they do, there are some out there that do want to get trained. And I think if there was something right off, oh, there's a perfect training, this is what you could use, and I think they would do it.
That's right. I think the point about having a primary care provider, pediatrician, nurse practitioner sit down with the provider or the family and talk about the administration, particularly a particular medication or creating a healthcare plan is a wonderful idea. The regulations, as you probably know, go into greater depth around general principles of medication administration, and in fact, to meet regulatory requirements, it needs to be a fairly in-depth curriculum, which is very difficult for busy pediatricians and nurse practitioners to do. But it is hopeful to hear that some providers have done that.
Oh, absolutely.
So, as I had shared with you before, we have been working towards the development of a new curriculum for medication administration, and really looking for feedback from child care providers and parents and others around what's important in creating a system. So I hear clearly that we certainly want to make available to every provider in this state medication administration training. And I wonder if you have any ideas about how we can do that efficiently.
I think one thing, and I know I've heard other people say this, if there are nurses that are trained that can go into these providers, these daycare settings, if there's a registry that the daycare providers can, if a family comes in and says, this is my child, they have some medicine that they need help with, and if there's a registry that the daycare providers can go right to, then they can call these nurses.
Right.
And I think that would solve a lot of the issues.
Well, certainly that is one of the ideas that we're considering, is working actually with Charts of Course, which is a registry for training for child care providers in the state, enrolling nurses who've been prepared to do this training so that we can do a match around groups of providers that need training and nurses that are available to provide the training. One of the other ideas we have is to create a calendar, a monthly calendar around offering trainings around the state, depending on the needs, so that providers can quickly and easily find trainings that would be available.
No, I think that would be great. I think the key point with that is to be sure to get around the entire state, not just hit Hartford or Waterbury or New Haven, get to the rural areas that, in the corners of the state that people, because there are daycare providers there.
Absolutely.
And they kind of, in those corners, they kind of get pushed to the side. So
That's
I think getting to the whole entire state so people don't have to travel that far would be very important.
Are there any particular areas of the state that you see as having the greatest need?
I know in the Northeast, they always, because there's just not a lot of resources up there. So I think if something went there, there would be a good attendance.
That's great. Good. And you're also working with providers as well as with parents?
Oh, absolutely.
That's great. Have you heard about any concerns about cost of training?
No, honestly, I have not. The providers that call us and say they want to do this, cost really doesn't come up because they want to do it. So I think they would think it's important for their business and for the children they're caring for.
We have collected some information that there's great variability about cost of training, and we certainly want to keep that in mind as we think about system development, so that the nurses are getting paid an appropriate salary, but that also it is reasonable for providers. And in some cases, as we move forward with developing a system, if providers, in fact, may need some support to attend that training, I think all of that would be looked at. So if you have any information in the future about that being as a barrier, again, we'd like to hear more from you and your group.
Yes, of course.
We're also thought about having an advisory group as we develop a system, thinking about representatives from health professional groups, from the American Academy of Pediatrics, the nurse practitioner groups, nursing groups, state agencies, and certainly child care provider groups and parent groups. Is that something that you think would be important, that your group would be interested in?
Oh, absolutely. We would absolutely be interested in. And I think it's so important to have parents or parent representation at the table.
Absolutely.
Because parents can't always get to these things because of child care issues. Or so, you know, an organization that works closely with families, I think, you know, as long as there's representation for families.
Wonderful. Great. Do you have any other ideas or thoughts you wanted to share?
Like I said, I just think making it accessible to everyone. I think if it's the less amount that people have to travel for some kind of a training, I think it would be beneficial to everyone.
That's great. The last point, I was thinking, because this came up when we spoke with the others in the group, was the issue of quickly and easily transferring like medication authorizations and special health care need plans between the primary care provider and the program. And I know sometimes that can take a fair amount of time and can delay a child's enrollment in a program. I've heard that, I've experienced it, and I wonder if you've heard the same.
Oh, absolutely. I think communication is just the most important, you know, good communication will just make any relationship a positive relationship. You know, when parents have to keep calling, and we get, everyone's busy, but when this is their child's health, you know, and when they have to continue to call, it becomes frustrating.
Great. Thank you.
Thank you.
Okay. Wonderful.